The environment has to be.
What we're saying is have a heart.
We've got to be able to regenerate our
There'll be people who are kind, people who are cruel, but that's life. You can be bigoted about things. I'm fine with that.
Maybe a good place to start would be the situation of AIDS in Singapore today. Since the year 2007, new HIV infections each year has been double the infections occurring in the year 2002. In 2012, a record 469 people were newly diagnosed with HIV, and this is a jump of 30% over the year 2006. And the trend seems to be slowly climbing. So HIV is on the rise, and first of all, perhaps we may ask, if we're only talking of a few hundred people, how does this figure compare with the situation in other countries? Have we reason to be complacent? Have we reason to feel that we are not that badly off in the Asian region?
Well, Singapore is a relatively low prevalence country, but there's no reason for complacency. I mean, any infection is too many.
Yeah, especially.
I mean, certainly we have a lower infection rate than, you know, a number of countries in the region, you know, such as Cambodia and Thailand and so forth. But still, I mean, there's plenty of reason for concern.
It's 400, but if the goal is to have 0 new infection, then it's 400 extra. And the actual numbers are just Singaporeans and PR. So we don't know what the actual figures are, and everyone else who's not seeking treatment in Singapore and not within the system, that could easily be 20,000, 15 to 20,000.
Yeah.
It's very difficult to actually measure how many people are infected because of the window period. It's very difficult to ascertain. Also, it depends because of the length of time that the virus takes to actually show itself. Yeah, so it could take up to 6 or 7 years to actually show itself. So under those
and during the 6 or 7 years, would the person be infectious?
Yes,
yes, they
very
will be.
Definitely.
Absolutely.
But isn't that a bit alarming that you can be infectious without knowing it?
Without symptom as well.
Yeah.
Without symptoms?
Without any symptoms.
Without symptom as well. So,
This makes the HIV virus a very successful virus. The person has it, can transmit it, and nobody else knows about it.
For 6, 7 years?
Yes. And you can even go up to 8 years or more in a rare few people. So most people would tend to present within 2 to 3 years to about 5 years. And by the 5th or 6th years, most people would actually have symptoms of the disease. And when they finally present to the doctors, they are rather late. What I would rather do is to catch the person's illness really early. Number 2, get the person treated. Number 3, stop the transmission in terms of education as well as controlling the virus. With this, we can start cutting our numbers down.
But you know, when you talk of early and a gestation period of 6 to 7 years, how early is early? How will somebody know if they have been exposed?
By being tested.
Sorry?
Basically, by being tested is the only way that you can
But
know
you
whether
say
you have
it
the
could take
virus.
6 to 7 years before it becomes evident.
No.
yes.
We can start detecting it about a month after it's
I think it's important
person
that
seroconverted.
We have to know that they are at risk. So on our part, we have to tell them that if you practice unsafe sex, you have multiple partner, you're at risk. Go for tests. Most of them thought that they are not at risk. No, my partner is safe. I know her for many years. She look healthy.
Yeah, people just don't understand.
But I'm confused. You say that you could have contracted the disease.
Just
and
don't
yet,
show symptoms.
And you don't show symptoms.
You don't show any symptoms.
And will the test then reveal that you are...
Yes.
Okay.
After a month exposure, you can go for the test. Even now,
so
not much of risk.
So it is not that it lies hidden for 6 to 7 years.
No, what it's doing...
But you have to go get tested.
The virus is actually multiplying inside your system over a period of time. Okay.
Physically, you got no symptoms.
Because the person can be infectious within 48 hours of infection.
So the other way of looking at it is, look around us. Besides Evan, who has declared himself, any of the patients with HIV will look like any of us.
So when I train a group, I will say to them, you know, for example, where's your husband this morning? And they look at me in astonishment and say, well, he's at work. And I say, well, how do you know he's at work?
You're trying to break up their marriage.
Exactly. So I say to I say, look, well, my husband's in Sydney at the moment. He wins a contract. He goes out with the local guys. Okay? He lands up in a massage parlor. Is he going to come home and tell me? And it's only when you start to realize that we are all at risk that you start to really begin to understand the issue of HIV.
Okay. Maybe, Doctor, you can explain to us what at risk means.
At risk simply means having sex with someone who may carry the HIV virus. Okay, so if you are in a monogamous relationship and you're having sex with nobody else, that couple will be quite fine. But the moment you stray, and that stray could be just a night of foolishness, a night of drunkenness, a night where you lost your inhibitions, that could be where the risk happens. I've got people who will tell me, Dr. Leong, I've only slept with one woman in my entire life, and this is the person. Then I say, I'm really sorry, you chose the wrong woman because you are now HIV positive.
Oh, okay.
And this is a real story. This is a real story. So it sounds very old-fashioned. If I can't have it my way, no sex until marriage. And when marriage starts, you never, ever leave that. Keep that together. You can talk about the 7-year each or whatever. No, it's not worth it. One HIV case is one too many.
And what are the means of transmission? It's through body fluids only?
Very good question. So most of the time, it's still sex. The risk of transmission is not...
Sex, can you define sex? Is it sexual intercourse? Is it...
Okay. So we talk about sex, we're talking about penetrative sex. The risk varies between 0.3 to 0.5% for receptive...
Penetration in any orifice?
Okay, let's talk about the conventional penetration into a vaginal sex. In the unprotected sex act, the risk is about 0.3 to 0.5%. And the other extreme...
When you say the risk is that if you have sex with an infected person,
yes,
then the risk of infection for the uninfected person is that low?
0.3 to 0.5%.
And it can occur if they only have the body fluids entering their body?
No, we're talking about penetration, a penile penetration into the vagina.
Okay.
Okay. As compared to the other extreme, where if a penile penetration into the anus, your risk can be as high as 3 to 5%.
Why is
for
that
the
higher?
receptive person. So in general, the rule is this: the person who is active, the person on top, will have a lower risk. The person who is passive, the one who is below, will have a higher risk. Number 2, vaginal sex is a much lower risk, about almost tenfold, as compared to anal sex. Anal sex is much higher. So there are men who think that I'm having sex with a woman, but does anal penetration, think that the risk of getting HIV is low. Think again, it is still anal sex. It's not by the individual, but by the sexual act.
What about penetration in other orifices?
Okay, in terms of oral sex, the risk is deemed to be much lower, but I do have patients who would swear that they didn't do penetrative sex other than oral sex.
Well, we figured in San Francisco it was probably about 6%, which is really high, but through oral sex, because what happens is there's a lot of movement inside the mouth, okay, and the skin of the penis is quite fragile, so it can abrade. And you know, when you brush your teeth, lots of people have bleeding when they brush their teeth. So when there's a lot of movement, you can have bleeding, which that's how you get transmission, and also through any ulceration.
But doesn't this apply to oral sex with a woman as well?
Yes, it does.
With the same degree of risk?
Okay, the risk for oral sex is hard to quantify.
It is.
It's very hard to quantify.
But you say in San Francisco it's been proven that it is...
That were the rates that we were given
6%.
at the time, yeah. When I was working.
There are various studies which quote different rates. I've got studies which show that the rates are less than one in 1,000. But the best thing rather is no sex outside of marriage, be it oral sex, or
Still
vaginal
risk.
sex, or
Yeah.
anal sex. Okay. Now, to understand the concept of risk, it's about.
Wait, I have got one more orifice. What about kissing?
Oh, kissing is perfectly fine.
Even though the person has got body fluids from the mouth?
Yeah, it's perfectly fine. There's only one
You endorse
dubious
that?
case.
Yes,
There's only
yes,
one
yes,
dubious
yes.
case that's reported where HIV was transmitted by kissing. Unless my whole mouth is ulcerated and the other person's mouth is all ulcerated.
Or there's a cut.
Okay, the risk is extremely remote. But given that situation, I wouldn't be kissing anyone.
Yeah.
To understand the risk, it's actually dependent to appreciate the tears that occur with the act. If I have a cup of HIV now and I pour it on my arm with intact skin, I will not pick up HIV. But with the sex act, you will have minor tears in the vagina, inside the anus, on the skin of the penis, on the glans penis. When that happens, the virus will make use of the opportunity and enter the body. The less traumatic it is, the less risk of transmission.